The spinal cord conveys information from the sensory receptors to the brain. Receptors are connected to the spinal cord by fibers of first-order neurons, the first nerve cells in the pathway, whose cell bodies lie in the dorsal root ganglion. Second and third-order neurons continue the pathway to the brain. Seen here in this longitudinal section, fibers of similar function ascend together in tracts or columns. The spinothalamic tracts receive information from the skin alone. The posterior columns from the skin, muscles, joints, and tendons. This information ascends to reach the consciousness, perhaps at the level of the thalamus, although it must enter the cerebral cortex to be properly interpreted. The anterior spinothalamic tracts carry crude touch and pressure information. The lateral spinothalamic tracts carry information from pain and temperature receptors. At the tip of the posterior grey horn, first-order neurons from the receptors divide into short branches which ascend and descend to form the posterolateral tract of Lissauer. They synapse with second-order neurons in the substantia gelatinosa of the posterior horn, then decussate almost immediately. In the brainstem, the two spinothalamic tracts form the spinal lemniscus. After joining the medial lemniscus, they pass to the thalamus and synapse with third-order neurons. Information from cutaneous receptors crosses to the opposite side of the spinal cord soon after entry. A lesion of one side of the spinal cord causes a loss of sensation on the same side of the body at the level of the lesion, and on the opposite side of the body below the lesion. Damage to the spinothalamic tracts may result from syringomyelia, a progressive disease which results in enlargement of the central canal of the spinal cord. This patient, whose syringomyelia affects the cervical spinal cord, has lost all sensation of pain and temperature from the level of his lesion downwards.
In my arms, yes, it's made them numb and I can't feel hot or cold, so that when I come in contact with anything hot, I'd be extra careful.
The pain of injury, like this burn, goes unnoticed, and injury may progress unchecked. Joint destruction, such as this so-called collapsing brick's spine, is typical. The posterior columns carry impulses from vibration, joint position, and discriminative touch receptors. Each column comprises the gracile fasciculus, which extends throughout the length of the spinal cord, and the cuneate fasciculus, which is limited to the cervical and upper thoracic segments. Axons of first-order neurons pass to the posterior column of the same side, where they divide. Short branches ascend and descend to synapse with cells in other segments and are important for reflexes. Most of the long branches ascend. Input from the sacral, lumbar, and lower thoracic regions ascends in the gracile fasciculus, and input from the upper thoracic and cervical regions ascends in the cuneate fasciculus. Fibers from segments higher up the spinal cord lie lateral to fibers from segments below. These first-order neurons ascend to the medulla, where most synapse with second-order fibers in the cuneate or gracile nuclei. After decussating in the upper medulla, they ascend as the medial lemniscus to synapse in the thalamus with third-order neurons. Some second-order fibers, called posterior arcuate fibers, arise in the cuneate nucleus to form the cuneo-cerebellar tract. It carries information to the cerebellum. Sensory information from vibration, joint position, and discriminative touch receptors ascends the spinal cord in the posterior column of the same side. A lesion on one side of the spinal cord thus causes loss of this type of sensation at and below the level of the lesion on that side. Posterior column damage, in this case bilateral, and caused by chronic alcohol abuse, can result in a stamping gait due to the loss of the sense of the limb position in space. Important for reflex adjustments of posture and muscle tone, much information on position and movement from the muscles, joints, and skin does not reach the consciousness. Impulses in the anterior and posterior spinocerebellar tracts, the spino-olivary tracts, and the cuneo-cerebellar tracts pass to the cerebellar cortex. The posterior spinocerebellar tract is formed by second-order neurons whose cell bodies form the thoracic nucleus. The tract carries impulses from first-order neurons of the same side. The thoracic nucleus is confined mostly to thoracic segments, and first-order neurons arising below this level reach it by ascending in the posterior column. Fibers of the posterior spinocerebellar tract traverse the inferior cerebellar peduncle to reach the cortex of the cerebellum. Like the posterior tract, the anterior spinocerebellar tract is formed by second-order neurons whose cell bodies lie in the thoracic nucleus. Some cross to the opposite side. Others ascend in the tract of the same side. They enter the cerebellum through the superior cerebellar peduncle. The spino-olivary tract is formed by second-order neurons whose cell bodies lie in the posterior column. Its axons cross the midline to reach the inferior olivary nuclei of the medulla oblongata. Third-order neurons cross back to enter the cerebellum through the inferior cerebellar peduncle. The spinotectal tracts ascend to the superior colliculi. They are important for visual reflexes, reflex movement of the eyes and head towards the source of stimulation. The spino-reticular tracts ascend to the reticular formation. They are important in influencing the level of consciousness.